Cancer therapy. Before cancer drug was developed, surgery was a common treatment for cancers. And also, the radiotherapy was invented for cancer treatment. Both methods are still valid methods, and combined methods usually give a better result. If you look at those radiotherapy, the problem is it should be highly localized scope, and if you increase the dose, then it can generate the toxicity along line the radiation. So this is only for the local area. The systemic the disease. Spread out the cancer is difficult to treat with radiotherapy. Now the paradigm shift was made by chemical reagent. So the first chemical reagent is nitrogen mustard, which has alkylating the reactivity in both sides. This reagent is developed in 1930s and has been used for chemotherapy in 1942 for the first time. Unfortunately, very similar other compound has been used as a toxic gas in the war. So in World War I and Iran-Iraq war, this mustard gases has been used for killing soldiers in battlefield. These molecules, they bind to DNA motif and then make covalent binding to the DNA molecule and shows the effect of an anti-cancer effect. Starting from the DNA alkylating agent, several different chemotherapy has been developed as the first generation of anti-cancer drugs. These drugs mainly target the highly proliferating, fast-growing cells. That is typical characteristic of cancers. Now, first generation of the chemotherapy can also induce a side effect. More specific, targeted therapy using signaling molecule inhibitor is the second generation cancer therapy method. Immunotherapy is the third generation of anti-cancer method. In this case, rather than directly killing the cancer cells, we teach our immune cell to kill the cancer cells. If you summarize the cancer treatment, the physical treatment such as the surgery started in 1880s, and radiation method has been started in 1890s. Chemotherapy started in the middle of the 20th century, and then 1970s, the targeted cancer therapy appeared, and then from 1990s, the immunotherapy appeared as a new cancer treatment method.